Welcome back to Paramedic Financial. This is Jonathan Tran. Today's topic in Finance in 5 Minutes is Medicare, right? So a lot of people you hear about Medicare, how do we qualify for it? When can we enroll in our Medicare? So generally with Medicare is that once you become 65 years old, you can qualify for what we call Medicare, which is insurance given to us by the government when we retire. Now, how do we qualify for it is there's a couple different programs in the Medicare that encompasses the whole program, right? The first part is called Medicare Part A, which covers your inpatient services, your hospital, right? And so in order to qualify for this one at no cost, you need to work a total of 10 years or 40 working quarters. If you don't have that requirement done, there is some cost to that depending on how many years you have put in, right? The second budget in the Medicare is Part B. Part B is your outpatient services, your doctor, when you go to your family doctor to visit. This program you have to pay depending on your income, right? So right now it's about $144 a year. Every year I see it go up, right? And it scales up depending on your income, right? So the higher your income, the higher your Part B is. Now on the reverse side is that if you are lower income, where you qualify for Medicaid through the state program, then the state program may elect to pay for your Part B. Depending on where you go, you may qualify for some help on that end. And then the third part to Medicare is Part D, which is your prescription drugs. Now this portion here is not covered by the government. This one you have to go on your own and purchase through private insurance companies to cover for your prescription drugs, right? These programs, you have to make sure that you enroll in a timely manner or you get penalized. When is the enrollment? So generally for the enrollment for Medicare is 3 months before your 65th birthday or 3 months after your 65th birthday. So you have a 6-month window to make sure that you get the right information so that you can enroll into the program in a timely manner so that you don't get penalized. And the penalty is factored on your Part B and your Part D. So don't think that, oh, maybe today I don't need my medication and I'll get my Medicare Part D later. You have to enroll both at the same time to make sure that you don't get that penalty. Because once that penalty happens, it sticks with you for the rest of your life, right? And so you want to make sure that you enroll at the right time. Now, another thing is some people may ask, okay, well, I heard that Medicare, original Medicare given to us by the government doesn't cover everything. That's true. There is co-insurances, co-pay deductibles that you have to pay out of pocket yourself, and the government covers for a portion. So sometimes there's 2 pathways that we can go when we get into Medicare. Pathway number 1 is usually what I call the flexible way. Right? You want freedom to go to any doctor you want, wherever you want. Maybe you travel a lot or you have kids staying in California, but you live in Texas or you live in Florida, and you want to be able to go any doctor anywhere. Then pathway number 1 may be more appropriate for you, right? You will pay for your Part B costs, and you will pay for your Part D costs. And then what you can buy is something called Medigap or Medicare supplement. And so when you combine all these things together, the Medicare supplement insurance will cover the gaps in your insurance that you have to pay that originally with original Medicare you have to pay out of pocket, right? So then you will pay a per month charge, but then you won't have to worry about any out-of-pocket costs throughout the year. That is one way that you can buy insurance, right? The cost of it costs you a little bit more money, but you're trading it for more freedom on usage of how you use your insurance. Now on the flip side, the private insurance companies have come out with something called Medicare Advantage or Medicare Part C, right? And so a lot of the insurance companies have collaborated with the government to provide the Medicare Advantage program at no additional cost or very nominal small cost to the patient or the people buying the insurance. So why do people go with this program? Well, sometimes you don't know when you're going to use your insurance, right? On pathway number 1, you're paying monthly, and you may not be using the insurance as you intended to cover all those deductibles and all those co-pays and co-insurances. While on the second program with the Medicare Advantage, you're able to control your monthly costs a little bit better, right? You still have to pay for Part B if your income is at a normal level and you're not at Medicaid qualified, but at least you don't have to pay out of pocket any additional. So what benefits do you get from that? Generally, the insurance companies will say, hey, you know what, you may be subject to out-of-pocket costs annually, maybe, just say for example, $3,000-$4,000, right, a year, if you were to use your insurance. But during the year, you don't have to pay any additional costs, right? They may give you extra programs like, get your dental done, get your vision done, gym memberships, all kinds of extra services to make it more convenient for you to take care of your health. And so, but a lot of times, what's the catch with all these, right? I get all these benefits, great benefits, including some places offer prescription drugs, coverage for a certain allotted amount per quarter. But what's the drawback? The drawback is that depending on where you live, your county, you have to use your services within that county. Now, if you have an emergency, like you're traveling and you need to use your insurance, you're able to use it for an emergency purpose. But if you want to get checked up and go to the doctor, you have to stay locally and you have to go within the network through the company that you choose. So, make sure that when you are, doing planning for your Medicare, is that, ask yourself the questions like, do I need that flexibility? Am I going to be traveling a lot, or am I going to be living in different places? What's the best plan that is appropriate for my situation, right? And then you can choose a plan and go from there, right? And the nice thing is that you can always change from, path 1 to path 2 interchangeably. Now, there may be some underwriting requirements when you make a change like that after the first time that you enroll, but at least there's some flexibility that you can change when your life circumstance changes, right? So Medicare is very, very important in our healthcare planning, whether it's for ourselves, for our parents, our grandparents, understanding how the Medicare works, will make it a lot easier to navigate, your healthcare needs in your retirement, right? And so other ways that you can qualify for Medicare is like if you're disabled, but that's a special case situation. But generally, Medicare is for those who are retired 65 and up, right? And then you can enroll. Now, when can you enroll into Medicare? The first enrollment is your initial enrollment. So anytime that 6-month window, when you come to 65, you can enroll. Now, after that, you can only enroll every year starting October, and it goes to the beginning of December, and then it closes. Now, if you are on Medicare Advantage, you have a second window from January to March where you can enroll again. Now, there are some special enrollments, like say, for example, you may be working, right? And you're already 65, but you're still working. But as long as you're still working and you still have insurance through your company, then you're not required to enroll in your Medicare yet, and you can postpone that. And once you leave your job, then there is a special enrollment window. Right now it's like 9 months, so that you can enroll into your Medicare program without penalty, right? So Medicare there's a ton of information out there. When you become 65, you will be the most famous person ever. The phone is going to ring off the hook, and you're going to have all kinds of people giving you a call, trying to sell you some form of Medicare policy. But it's always smart to get educated first about what your options are depending on what you need. So, give us a message below, contact us, make sure you subscribe to our channel for more information like this, okay? Thanks a lot.